Okay, this video is about oral irrigators and oral irrigation and how it may be helpful to you. Now, some of the things I'm going to say are based on personal experience, so therefore I have to make the statement that the US FDA has not evaluated any statements in this video, and that you should always be under the care of either a dentist or a periodontist or a doctor for any health issues that you have or think you might have. And this video is for information purposes only. It's not here to provide advice, diagnosis, or treatment for any condition or any sort of health ailment whatsoever. So again, you should always be under the care of a doctor when you're dealing with any type of health issue. So we're going to talk about oral irrigation today. If you visit a dentist or a hygienist, many of them will tell you that oral irrigation is good. It does appear that it has an effect upon your dental health as far as reducing plaque buildup. In particular, this irrigator here, the HydroFloss oral irrigator, has been demonstrated twice in the Journal of Clinical Periodontology, and that's in May 1993 and again in April 1998. The HydroFloss was studied, and its technology, which involves the use of a magnet. There's a long cylindrical magnet in the handle, and this has been studied and demonstrated and shown that the HydroFloss does have the capability, according to these two studies, to reduce plaque buildup between office visits to a greater extent. For me personally, this device was able to help me reduce my pocket depths, and it was also able to help me to avoid a root scaling and planing, or scaling and root planing treatment, also known as an SRP, or a deep cleaning treatment. My dentist told me I needed one. I was told that was the only thing that was going to help me, and that my hygienist said I had to sign a waiver saying that if I lost my teeth, it wasn't their fault if I didn't go through their deep cleaning treatment. I declined their treatment, and to be fair, I went out and did my research. One of the items I chose to utilize was the HydroFloss, which you see in front of you. I used it for approximately 5 months, and I went back to the same dentist. And that's key, because this is the dentist that told me nothing else was going to help me. So when I went back, she told me, they both stared at my mouth for a long period of time, and the shock and look of disbelief on their face was worth its weight in gold, so to say. At any rate, they ended up concluding that everything was better, and I was actually told by the very same dentist that I no longer needed that treatment, and that whatever I was doing, I should keep it up. So oral irrigation, oral irrigators, and in particular the HydroFloss oral irrigator, appears to be helpful in regards to your dental health. Now again, I'm not making any statements or health claims here. You need to be under the care of your physician and get your diagnosis, treatment, and advice from them. I'm just saying that this appears to have worked for me, and I do talk to a lot of customers about this device. I sell it at the Toothy Grin store that you see on your screen here, and I'm hearing very similar stories from many of my customers about what this device has done for them. So that's all I can say. I can only tell you my personal experience. I want to stay out of the realm of health claims, because you know how the US FDA is behaving nowadays. So keep in mind that none of the statements here have been evaluated by the US FDA, and you should always be under the care of a physician or doctor and get your advice, diagnosis, and treatment from them. However, I did share with you my experience with the HydroFloss and oral irrigation, and now you have that information. Thank you for watching this video. Take care and have a great day.